Welcome to Global Medevac, America's premier worldwide emergency transportation protection. For over 40 years, our leadership have worked to provide the best in emergency medical transportation coverage. Global Medevac gives you peace of mind that you will not suffer financial difficulty should you need emergency medical transportation. With Global Medevac, you no longer will have to deal with gaps in coverage, poor customer service issues, or claim payment problems. And all plans are guaranteed issue. You cannot be turned down. With Global Medevac, you are family. During the current global medical crisis, it is comforting to know that with Global Medevac, you have a family looking out for you. The ongoing pandemic has changed the way we work, play, and live. It has changed the way we access medical care. Emergency medical transportation is being used to transport patients to appropriate treatment facilities. With Global Medevac, you have the peace of mind knowing that you will receive the best in service 24 hours a day, 7 days a week. With the Global Medevac plan, you and your family have access to the best hospitals in the U.S. A key component of the Affordable Care Act, or Obamacare, requires cuts in Medicare spending of $716 billion. A large portion of these cuts are achieved in Medicare's denial of payment for services. Often, Medicare will only cover ambulance costs to the nearest medical facility without regard for next level of care, and hospital-to-hospital transports are rarely covered. Medicare now reviews all claims for emergency medical transportation to determine medical necessity. If their review of an ambulance transport does not meet their claim requirements, the claim is denied and no payment is made. And, as you may know, when Medicare denies payment for a service, your Medicare supplement insurance will also deny payment. The cuts to Medicare present a dilemma to patients and hospitals. Due to lower payments by Medicare and Medicaid, rural hospitals are being forced to close. Lower payments by private health insurers due to transferring more of the cost to patients through higher deductibles and copays, and non-payment of bills by private pay and non-insured patients is contributing to the financial strain. This article from a 2019 issue of Business Insider tells a concerning story that 21% of rural hospitals across the U.S. are at risk of closing unless their financial situation improves. Level 1 trauma center hospitals provide the highest level of care and are staffed with surgeons and specialists 24/7. Due to the expense involved, there are not a lot of these facilities, and emergency medical transports can be costly, as shown in this ABC News Nightline story.
The surgery itself was a total of $16,000, and the helicopters nearly $35,000. It just seems a crazy amount of money.
That was Jean Medina. At the time, her concern was getting her daughter the help she needed. Cost was not a concern. Then, she received her bill only to discover that the cost of the air ambulance was more than double the cost of her daughter's hospitalization. I've shared with you how the high costs of these services are increasing and how Medicare and private insurers are paying pennies on the dollar. Let's take a look at an actual ground ambulance bill. This bill for a 20-mile transport was over $1,700. After Blue Cross Blue Shield of Texas paid, the patient received a balanced bill of more than $1,300. Think what this bill would have been had this transport been 100 miles or more from a rural community to an urban hospital. Now, let's take a look at a couple of air ambulance bills. In this first bill, the patient had Blue Cross of California, one of the best payers in the country. The base charge alone was more than $33,000. Mileage charges and medical equipment utilized during the transport brought the total close to $42,000. Blue Cross paid $33,000, leaving the patient with a balance of $8,300. This second bill, totaling more than $33,000, was denied by Golden Rule Insurance, leaving the patient responsible for the entire amount. Even more concerning is that the cost of these transports is increasing substantially every year. So the question today to answer is this: are you prepared? Are you prepared if you or a family member are one of the 500,000 air ambulance patients transported annually, or for the bill you will receive for an emergency medical transport, and to learn just how little your insurance paid for that transport? Are you prepared for medical emergencies that can happen with domestic and international travel, and to get yourself or family member back home following an emergency? If you know you're not prepared, join now. Fortunately, Global Medevac is the best solution for you and your family, protecting you from these high costs both at home and while traveling. Global Medevac gives you the peace of mind knowing that you will not suffer financially when you need emergency medical transportation. And with Global Medevac, you have the peace of mind knowing that our leadership team are the pioneers of this industry with more than 100 years of experience protecting families like yours. Now, let's look at your coverage options. All Global Medevac plans include the medical emergency transportation coverages shown here: medical evacuation and emergency air transportation, emergency helicopter and ground transportation, medical repatriation, and paramedic-assisted flights home. Additionally, non-emergency transportation benefits covered with every plan include return, visitor, and escort transportation, minor grandchildren and minor great-grandchildren return, vehicle return, mortal remains transportation, spouse return, organ retrieval and organ recipient transportation, pet return, our worldwide coverage, and a Global Medevac exclusive benefit, transportation to rehab, skilled nursing, and hospice facilities. With our lifetime plan, you receive these Global Medevac exclusive benefits not offered by any other provider plans: emergency transportation for minor grandchildren and great-grandchildren while they are in your care, miscellaneous travel expenses, worldwide emergency ground, and transportation for terminally ill patients are included. With all of the coverages and benefits of our memberships, rest assured knowing that we have a membership to fit into any budget. We offer 2 membership options: the Annual Premier and the Premier Plus Lifetime. The Annual Premier membership is available with 3 convenient payment options: monthly for $60 per month, annually for $695, or a 5-year for $3,150. For those 55 or older, the Premier Plus Lifetime Plan provides the best protection with a one-time payment of $3,250 for an individual or $4,250 for family. Your Global Medevac representative is available to assist you in completing the enrollment application. Join today at globalmedevac.com or by calling 817-225-0177.